President Mr. Justice Adrian Saunders, Conference Chairman Mr. Justice Winston Anderson, Chief Justice Dame Janice Pereira, Day Chairman Mr. Justice Andrew Burgess, distinguished Attorneys General, judges, jurists, colleagues, and friends, good afternoon. Before attending this conference, I used to only fear God, but now I fear God and Mr. Justice Barrow with a stopwatch. I will therefore be brief. Dear Chair, I apologize for physically leaving this enlightening conference yesterday, but I had to return to St. Kitts early to safeguard my family and home, given the impending passage of Tropical Storm Tammy, which is expected to become a hurricane by this evening. Let us never forget that climate change is real, and we, the intellectual and political elite of our climate-vulnerable nations, must openly support the advocacy of our leaders on the international stage when they seek funding to invest in climate adaptation initiatives and the transition to cleaner energy sources. There will be little concern about criminal justice reform if more frequent and more intense hurricanes and rising seas begin destroying our homes, infrastructure, and lives. On a less somber note, and despite my physical absence, I am pleased to address you by this means today on the topic of crime and public health. I loved every minute of this conference. It was truly excellent. The gems of knowledge gained will reverberate through my mind forever. Gems such as DPP Llewellyn's plea negotiation massages and co-accused weak link strategies, Sarah Abraham's victim rights heroism in Antigua, and Mr. Justice Greaves, aka Denning's, unashamed recommendation of renaming and repositioning magistrates as summary judges, and of course, Bette Midler song quotes. It was truly a thought-provoking and socially enchanting experience for me, as I'm sure it was for the delegates and law students in attendance. I am before you to speak on the topic of crime and public health. You are probably thinking, like I did when I saw this topic on the program, how does the connection between crime and public health fit into a criminal justice reform discussion? As I dug deeper into what criminal justice truly is, it made perfect sense. From a macro level, criminal justice is a network of systems determining the guiding policies and procedures used to address and prevent crime. We have spent the last 3 days engrossed in discussions surrounding the critical topic of reforming those guideline policies and procedures in the Caribbean context. What you do in this room, as law enforcement, prosecutors, defense counsel, and judges, is the downstream process of addressing crime by ensuring the criminal justice system works. What I will be discussing today is the upstream approach to tackling the root cause of our common crime problem in a scientific way. To do this, I will step into the shoes of my Prime Minister, Honorable Dr. Terence Michael Drew, who addressed this issue at the CARICOM Regional Symposium on Crime and Violence as a public health issue held in Trinidad earlier this year. Public health promotes and protects the health of all people and their communities. It is science-based, evidence-backed field which strives to give everyone a safe place to live, learn, work, and play. The common denominator between the Prime Minister and I is that our past education streams and professional lives have shaped how we think, him as a medical doctor and me as a civil engineer. We fundamentally believe in science, statistics, and solving problems methodically. What is the shared problem we face in the Commonwealth Caribbean? The answer is easily found in the lyrics of Senator John King's song, How Many More? So many sons lost in the slaughter, blood running in the streets like water, too many hopeless souls in the city. A profound and appropriate cultural selection to start this conference. Our shared problem is the now baked culture of rampant criminality and violence, especially amongst our young men. Persisting issues of delays in prosecuting those men charged with criminal offenses, leaving them in jails to get even angrier and more equipped for further criminality. And our shared governmental failures to adequately address and rectify either problem. What is the solution? Dr. Drew fundamentally believes that the only way to combat our region's crime and violence cultural epidemic is through scientific intervention strategies. For 2 decades, Caribbean public health experts have recognized that, like diseases such as measles, dengue fever, and HIV/AIDS, violence can be characterized by epidemiological triad of disease causation, consisting of agent, host, and environment. For example, COVID-19's agent is a virus, the coronavirus. The hosts are animals and humans. The environment which allowed COVID-19 to spread so rapidly was the social nature of humans, who cherish interaction with other humans. The agent in the context of crime and violence is the virus of psychological rejection of societal norms and laws. The hosts are predominantly young men, and the environment is shaped by structural, social, and commercial causes of injustice, inequity, family-based toxicity, and easy access to firearms. These elements facilitate the transmission and virulence of the crime and violence epidemic in our region. Traditional approaches to crime control have often relied on punitive measures, such as incarceration and law enforcement. But these strategies have shown limited success in reducing crime rates. To truly address the complex problem of crime and violence in our communities, a paradigm shift is needed. Treating crime as a public health issue offers a comprehensive approach that not only addresses the consequences of crime, but also focuses on the root causes, ultimately leading to safer and healthier communities. Treating crime as a public health issue means recognizing that crime and violence are not isolated incidents, but have far-reaching consequences that affect individuals and society as a whole. Just as public health strategies are employed to prevent and manage diseases, a similar approach can be applied to prevent and manage crime and violence. The urgent task at hand, therefore, is to implement best practice interventions, much like what we did to mitigate public health infections. 3 primary intervention fronts are recommended. Interrupt transmission. Engage credible influencers to have one-on-one contact with the hosts. Prevent further spread among those exposed. Implement behavior change interventions. Change societal behavioral norms. Advocate for policies that promote anti-violence, robust education, healthy food habits, economic independence, stable homes, sustainable resources, social justice, and equity. These interventions are part of our toolkit to mitigate HIV, COVID, and other public health issues. So why not apply them to our crime and violence epidemic? Interrupting the transmission of crime and violence requires recognizing that violence and criminal propensities are learned behavior. Nefarious learning can be prevented, and what is learned can be unlearned. There is no one-size-fits-all solution. It is a multi-sectoral and multifactorial approach. Violence interrupters, individuals with street credibility, high emotional intelligence, and strong communication skills can be trained and deployed. By treating crime as a public health issue, early intervention becomes a cornerstone of the strategy. Identifying individuals at risk of criminal behavior at an early age and providing them with the necessary resources and support can help break the cycle of crime. This includes initiatives like youth mentorship programs, after-school activities, and community outreach. To prevent further spread, we can track and trace young people exposed but asymptomatic, offering them a suite of targeted interventions. While tackling violent crime demands domestic and multinational efforts, some prevention and control issues are local. These include addressing the profit motive driving gang formation, improving home conditions that facilitate recruitment, and creating an enabling environment for youth and families to thrive. Changing societal behavioral norms involves behavior change communication, focusing on respect for life, human and social rights, justice, equity, compassion, well-being, and more, while actively countering misinformation, disinformation, and other negative influences. Investment in education, job training, and affordable housing can be seen as crime prevention measures. Public health approaches rely on data and evidence to make informed decisions. Similarly, applying data-driven strategies in addressing crime allows for a more targeted and effective response. Identifying crime hotspots and understanding the demographics of those involved can help direct resources where they are needed the most. Public health issues are rarely solved by one sector alone. Similarly, addressing crime effectively involves collaboration among various stakeholders, including law enforcement, healthcare professionals, social workers, educators, and community organizations. This multidisciplinary approach fosters a more holistic response to crime. Key sectors play a crucial role in implementing these interventions, including national security, public health, education, social services, and youth, sports, and culture, as well as business and civic groups. These sectors need to invest time and resources in youth programs such as Scouts, Pathfinders, Girl Guides, and Youth Parliament. What are the benefits of a public health approach to crime? Reduce recidivism by focusing on rehabilitation and support rather than punishment. Individuals who have committed crimes are more likely to reintegrate into society successfully. Safer communities. Targeting the root causes of crime leads to safer communities where violent and criminal activity are less prevalent. Cost savings. The public health approach can be cost-effective in the long run by reducing the burden on the criminal justice system and healthcare services. Improve public health. Addressing the social determinants of crime can lead to improved public health outcomes benefiting society as a whole. Treating crime as a public health issue represents a forward-thinking and comprehensive approach to addressing the multifaceted problem of crime and violence in our communities. It recognizes that crime is not merely a law enforcement issue, but one deeply rooted in social and economic disparities. By investing in prevention, early intervention, and addressing the root causes, we can create safer, healthier, happier communities for everyone. This approach promotes a society where individuals have the opportunity to thrive, reducing crime and improving the overall well-being of our communities. With the right political will, we can address this pressing issue. The Caribbean has a proud track record of addressing major public health issues through evidence-guided interventions. St. Kitts and Nevis is ready and willing to move from research and experience to robust and sustained action. We have the tools, the knowledge, and the commitment to address crime and violence as public health issues. It is time to act collectively and decisively to change the climate of violence in our beloved Caribbean. Thank you for your attention and have a pleasant rest of your day.